So if you're a child or if you're an adult who has a family history of asthma, guess what? You're more at risk to have asthma. So family history is very important.
Hello, welcome back to Pediatrics To-Go. Today we're talking about asthma in children.
Thank you. Asthma in children is actually becoming more common, and it's commoner in areas where there's a lot of cold, like cold countries, where there's a lot of dust, dusty countries with deserts, and also where there's springtime, certain times of the year in countries where you have 4 seasons, springtime, wintertime, and fall, depending on the type of plants that are, or vegetation that's present in that area. So if you're a child or if you're an adult who has a family history of asthma, guess what? You're more at risk to have asthma. So family history is very important. When children come in and parents tell us 2 things, oh, my child is always congested and sneezing, and the child has been coughing for more than 2 weeks, guess what? You probably have asthma. And the reason we say that is because when we ask questions in America, in Nigeria, the answer is usually, so mom, how long has your child been coughing? Well, he always keeps a cold. It seems like the cough never goes away. And the cough tends to be worse at night. And most times you ask further, yes, there's a family member who used to use Ventolin inhalers when they were young, but they outgrew it. So once there's that history of a family member who has been on Ventolin in the past, there's a history of coughing, there's a history of, they've been diagnosed with bronchitis, that's asthma until proven otherwise. If a child has a cold and is never taken to the doctor, most times the cold should be gone in 7 to 10 days. If your cold is lasting more than 2 weeks, the cough is not going away and the cough is now deep, and especially after the doctor has given you antibiotics for a sinus infection, the cough is not going away, you probably have asthma. Asthma can be diagnosed, it's a clinical diagnosis. If you go see your doctor, you're wheezing, the doctor will put you on 3 important medications. They will put you on an inhaled medicine called Ventolin. That is what we use. We call it a rescue inhaler. Basically, if your lungs are, imagine asthma is a situation where your lungs are hyperreactive. So you might have had a cold that had made you wheeze. Most times there's viruses that would do that. You have your RSV and human metapneumovirus, which are the common viruses. But once you've had a cold, your airways, if they're nice and open like this, the infection can cause your airways to be smaller. So you give the Ventolin, it opens up the airway, but Ventolin only lasts 6 hours. After 6 hours, what happens? Your airway have been opened by the medicine, it's closing up again. So you need to keep taking the Ventolin. But steroids are what we usually give to children who have a history of asthma. There's the oral steroids, there's the inhaled steroids. Steroids are called controller medicines and they keep your lungs nice and open. So if your doctor has diagnosed you with asthma and you're only on albuterol, ask your doctor about inhaled steroids or even the oral steroids. The oral steroids we don't like to use so much because there's side effects, but the inhaled steroids, a lot of my patients are on inhaled steroids and they take those inhaled steroids every single day, especially when I lived in New York, New Jersey. And I never saw them and I'm like, oh, you only came for your physical? And they're like, yes, because the asthma medicine works great. So ask your doctor about inhaled corticosteroids and make sure that your child is taking the medicine so that you are not always going to the hospital. Oh, my child is coughing, cough fever. No need for that. There are other class of medicine. So you have your albuterol or Ventolin. You want to use that if your child is getting short of breath. You want to use your inhaled steroids, which is a controller medicine to prevent you from having prolonged episodes of asthma. And the third thing is antihistamines. Antihistamines like your common Benadryl, Claritin, Zyrtec, that helps to keep your lungs nice and open just so that, and it decreases the amount of mucus. Antihistamines stop mucus production in your airway, and that prevents the cough from getting worse and makes you feel better. So those are the 3 classes. There's other classes like your single-air, which are the leukotriene inhibitors. Your doctor can tell you more about that. But if your child is always coughing, always congested, always short of breath, there's treatment for that. Your child doesn't have to suffer. Get the care your child needs. And the diagnosis of asthma can be a lifesaver because you end up getting the care that you need. It's better to diagnose your child with asthma and give them the medicine than not, and then your child gets short of breath. And asthma can be lethal if it's not treated. So please see your doctor if your child is having prolonged coughing and congestion.
Is nebulizer used to treat asthma in children?
Yes, nebulizers contain the Ventolin, which is in the inhaler. And for small children, we give them the nebulizer treatment that you can do every 4 to 6 hours, depending on how bad the cough is. When you go to the hospital, sometimes we can double the medicine and give like 2 or 3 treatments back to back to open up the lungs. And then by the time the steroids kick in, everybody's good and the child goes home on the medicine that they need.
Oh, wow, that's good. Anyway, thank you very much for keeping up with us till this point in time. If you're yet to subscribe to our YouTube channel, please don't hesitate to do so. Follow us on our social media pages at Pediatrics To-Go. And until next time, bye.
Bye.